When the weather gets colder, people start spending more time indoors, we will see a number of cases starting to rise.
Alarming comments from the head of the Harvard Global Health Institute, but it makes sense, especially when you consider that the U.S. is approaching 5 million COVID cases now. We've already surpassed 159,000 fatalities, and as you heard them, the weather as it gets worse can make a bad situation that much more. Plus, we are continuing to see more than 1,000 deaths from the virus each and every day. In the U.S., faring worse than the rest of the world, and it's not even close, frankly. New York Times columnist David Leonhardt, he did a very good job, I thought, today of describing it. Quote, over the past month, about 1.9 million Americans have tested positive for the virus. That's more than 5 times as many as in all of Europe, Canada, Japan, South Korea, and Australia combined. Now, despite that, President Trump continues to say the U.S. doing a better job than other countries and the virus is under control. President, he was in Ohio visiting as we speak, meeting supporters and, of course, raising money. It should be noted, just hours before he was supposed to see Governor Mike DeWine, governor's office announced that DeWine tested positive for COVID. Now, we've been talking a lot about the schools and how the president keeps pushing for them all to be reopened no matter what. Well, now we're learning more about what is going on, certainly at the college level. 275 schools and counting, they've reported cases. The total is approaching 7,000 people who've tested positive. And as you can see from this map, just about every state is impacted. And the academic year hasn't even started for most schools, so it is expected to actually get worse instead of better. And we continue to hear horror stories from nursing homes. It's estimated that at least 40,000 residents of those facilities, they've died from COVID so far. The latest outbreak happening at a home in Houston where 19 residents have died. 24 staff members have just tested positive. Now, many of the people watching as we speak right now, they could have loved ones in a nursing home, and obviously, you have concerns that go along with that. My next guest, she has been writing a series of pieces in The Guardian, I think some of the best reporting on this, about systemic problems in the nursing home industry and how their business models are impacting their care. She's also the author of The Good Death, an exploration of dying in America. Let's bring in our guest now, Ann Neumann. Your pieces, I think, have done as good a job as anyone in painting how profitability and quality of care are, if not mutually exclusive, they're working against common interests here. I want to start first with the term I learned through your reporting, transfer trauma. Explain to the audience what that is and really how your ability to pay could literally have you out the door of a nursing home.
Yeah, well, we see that in so many other industries, right? In the healthcare industry, notoriously, where individuals get the quality of care that they can afford. So it takes inequality and racial disparity and all those issues off the table and basically reduces people to their purse. So nursing home care is no different. Individuals who have Medicare, say, break a hip, need rehab, are sent to a facility, and once that Medicare is exhausted, which doesn't take very long, they are quite often booted. There are other individuals who need longer-term care who are not able to go back to their homes and require an extended stay. And they are not the desired patient that many facilities want. They want folks who have that higher Medicare payment. And when it comes time for patients to apply for Medicaid, facilities are quite reticent to help them. And so where I did most of my reporting in the state of Pennsylvania, and specifically in Philadelphia, where the elder population is one of the lowest income populations in the country, what individuals there, advocates, had seen were facilities dumping patients on a regular basis. In fact, it's a kind of strategy for industry consultants to pursue. You will see facilities that have long-term care patients on one floor and Medicare patients on another. And this is their objective, to maximize the higher paying client and to kick the rest out.
And you profiled one man who literally in the course of a year had been moved 6 different times here, all predicated on his ability to pay. And it sure as heck looked like from the piece the quality of care reflected it. Now, in terms of dollars and cents, and we've seen nursing homes exposed here for the lack of protocols they've had, et cetera. It's not just that they're poorly run or have a wrong manager in place, I got from your series. And in a lot of cases, there's a direct and a conscious attempt to cut overhead at all possible opportunities. And as a consequence, they keep selling these from one set of hands to another, and everybody's first move is, how do I cut either staff? How do I cut quality of care? And then COVID comes around, and then everybody sees just how badly equipped they are to handle it.
Yes, exactly. This series we started this series last February, so we've been at this for a while, and we began this inquiry before COVID. And what we were hoping to do was identify a number of the systemic problems within the industry. And then COVID came along, shocking all of us. I mean, what we're seeing now is horrifying carnage. And it should concern all of us because we will all be in long-term care. About 70% of us end up needing long-term care at some point. So this should be shocking to us. And what we found, not surprisingly, was that the problems that we had initially identified are indeed the ones that have led to this crisis within nursing facilities. And it's exactly what you say, the preference, the prioritization of higher paying patients, the prioritization in facilities of everything other than labor, right? One of the greatest effects on the quality of care for elders is the quality of their staff members, who's doing the caregiving. And when we see facilities cut labor again and again, and I also want to emphasize that we're seeing this across corporations worldwide. This is kind of the first step that we see corporations take to make savings, is depreciating the quality of life of their staffers. Nursing homes are doing the same thing. They are understaffing. They are underpaying their staff. Staff members in the United States make $19,000 or less a year on average, and many of them are on food stamps. Many work multiple jobs, and so when we saw the initial case of nursing home deaths en masse in Washington State, there are a number of individuals there, staff members, who had to work multiple jobs. And so right there, we saw the ability of COVID to move through facilities simply because facilities were not paying their staff members enough.
Did you find, Ann, that the regulation, I know these are for-profit, private companies, but we saw this play out, or at least I did. I was shocked at how little states oversee these nursing facilities. It's almost like, for me at least, nobody wants to deal with this problem. And the less they get their hands on it, the less that they'll have any culpability down the line. Did you find that even if people knew there was a problem with nursing homes, nobody really wanted to get involved because it was such a big headache?
Absolutely. Again and again, lack of regulation or even enforcement of regulation, those two together are probably the single most important problem that we're seeing here. Staffing levels may be regulated in some places, not enough as far as I'm concerned, but there's little enforcement, and if there is any enforcement at all, it's a fee that does not measure to the violation. So there's a huge lack of regulation all across the country. Some states are better than others, but I spoke to Senator Casey in Pennsylvania when I was doing this reporting, and he got together with another Pennsylvania senator, a Republican, Toomey, and they had pressured the Centers for CMS, the Centers for Medicare and Medicaid Services, for a long period of time to get data on the 400 not absolute worst facilities in the country, but 400 next worst. And what they found was that industry pressure had prevented CMS from releasing that data for years. And so when those two senators received the data last year, they released it themselves. That's the state that we're at right now.
I'm curious, I know you have another part of the series coming out about states moving here to give qualified immunity, in effect, to nursing homes. And certainly a lot of these guys have been bad actors, and COVID has exposed just how unprepared they are. But are you also concerned that if these folks are made to pay the piper, which they should, that they're going to shut our doors here. And where do these populations go of seniors that need care, given already, albeit substandard care, a lot of them are putting out? What do you think should happen to a lot of the nursing homes that didn't handle this the right way, albeit the states weren't necessarily good partners either in this process? But what do you think the consequences will be as well?
Oh, hideous. It's going to be terrible. I mean, if you can imagine, when any facility closes, all those jobs are lost. All those people are thrown to the street. Residents are forced to find new places to live. And that is indeed the risk, because the state, and as you perfectly put it, the state and these facilities have been bad partners. They haven't worked together. I don't think there's any doubt in anyone's mind that nursing facilities are underfunded at the federal and state level. We need to change that. However, the lack of regulation and enforcement of that regulation has created an environment where elders are preyed upon by bad actors, and that needs to change as soon as possible. As COVID has shown us, it's causing mass deaths.
It's a fascinating series The Guardian has done, and Ann's been at the front of it. Check out Ann Neumann's work there. And I appreciate a few minutes. Thank you so much.
My pleasure. Thank you.
All right, everyone, when we come back, we will pivot to the presidential race. We're going to show you some new numbers that give us a snapshot of where we stand here. We're looking at the polls, also following the money, which could be just as telling.